So hi, my name is Sandy Grenoble, and for my presentation, I chose to do epilepsy, and I'm going to be discussing the basic definition, the signs and symptoms for diagnosis, and benefits and modifications to exercise. So first, what is epilepsy? There are many misconceptions as to what the definition of epilepsy is. It has been shown that 10% of the adult population does experience a seizure at some point in their life. However, just having a seizure does not necessarily mean that they have epilepsy. Epilepsy is a neurological disease that affects the central nervous system and causes seizures, which is why sometimes it's often referred to as seizure disorder. The new definition established by the International League Against Epilepsy in 2014 wanted to have a definition that was more practical and included these three conditions that people with epilepsy have. The first being at least two unprovoked seizures that occur more than 24 hours apart. These can be two different types of seizures, or they can be the same seizure, and talking with their doctor will help determine what type of seizure it is. The second condition accounts for the high recurrent risk of having a second unprovoked seizure after the first one. So if the physician deems that the person is at a greater risk than 60%, then they could be diagnosed with epilepsy. And then the last condition is that if someone has an epilepsy syndrome, even if they're not at a high risk for seizures, they can still have epilepsy. All right, so epilepsy is a pretty popular disease. It affects 3.4 million people in the US each year, with 150,000 new cases each year, and 1 in 26 people in the US will develop epilepsy at some point. So in order to diagnose epilepsy, there's many things that are taken into account. The definition is a good starting place, but in order to determine the types of seizures and everything and what type of treatments options to try, there's more that goes into the diagnosis. So imaging via an electrosenogram, often called an EEG, can detect abnormal brainwave activities to determine if anti-seizure medications are beneficial or not. And some people may not experience these brainwaves, or some people without epilepsy do experience abnormal brain waves. However, there is a specific type of epileptic wave that includes many spikes and different types of waves. CT and MRI scans are also important because they look at brain structure and can determine any abnormalities that may trigger seizures. One of the most important things, though, is the detailed medical history. Information about the seizures and the aftermath of the seizure can help determine what type of seizure it was. Having a family member or someone who witnessed the seizure is also a good idea because typically people who have the seizures may not recall what happened the entire time. So having a witness can help gain more information. And any other past illnesses or symptoms are important, as well as family history of seizures. Blood tests can also be used to diagnose because they can show any metabolic or genetic disorders or underlying health conditions that could be possible triggers for seizures. There can be possible triggers such as fatigue, stress, repeated traumatic brain injury, and excessive hyperventilation. However, most seizures don't come with a certain cause, and the best way to determine your triggers would be to track what happens before and after seizures. So seizures are generally classified into two main groups based on the area affected in the brain. Generalized seizures affect both sides of the brain and can be further classified by their symptoms. So an abstinence seizure can occur when a person appears in and out of consciousness, but remains postural control. This can include blinking rapidly or looking as if they're staring off into space, but normally regain consciousness after a few seconds. Tonic-clonic seizures are the most common, and they affect 20% of people with epilepsy. People who experience a tonic-clonic seizure lose consciousness, may have muscle spasms, convulsions, cry out, and they lose postural control. Typically lasts 1 to 3 minutes. If it is longer than 5 minutes, medical attention may be needed, and people around will need to call 911 because that is not normal. An atonic seizure is a brief loss of muscle tone and postural control. It typically only lasts a few seconds It can be referred to as like a drop attack or a drop seizure because in kids, typically their head will drop, and that's when you'll know that they're having an atonic seizure. And then the second type of seizure is a partial or focal seizure. And these affect only one part of the brain, and some symptoms depend on what part of the brain is being affected. So a simple focal seizure only affects a small part of the brain, and it can include symptoms such as twitching or a change in sensation. They remain in complete consciousness though. Complex focal seizures occur when a person is unable to maintain contact with the environment around them and appear to be dazed or confused. And then secondary generalized partial seizures is when a seizure begins as a partial seizure and evolves into a generalized seizure. So this picture kind of just further explains partial seizures. As you can see, they are typically experiencing more symptoms like due to behavioral issues, whereas in the temporal lobe, they typically experience more imagery, change in smell, etc. All right, so it has been shown that epilepsy exercising with epilepsy can have extreme health benefits. And even though people with epilepsy tend to perceive their health as poorer than the average human being, previous research has shown that exercise can negatively impact someone with epilepsy, causing them to have a seizure. However, since then, there's been a lot more research done, and it has actually been shown that regular exercise can be beneficial in controlling seizures in some people and only has a few restrictions. Those who have uncontrolled epilepsy are at a greater risk for seizures and injuries during exercise. When creating an exercise plan, it's important to discuss these types of seizures, their frequency, and the triggers or symptoms that they typically experience. Those who note tonic, clonic, or atonic seizures will be at a higher risk of falling and injury due to that loss of consciousness. Those who have controlled epilepsy have minimal risks when exercising and can exercise according to the healthy population guidelines, taking into account what treatment methods that they may be on, because certain medications may trigger other symptoms. But regardless of whether or not their epilepsy is controlled or uncontrolled, it's recommended that people with epilepsy avoid certain sports. So motor vehicle sports, height-related activities such as skydiving or scuba diving, require full concentration, so it's easier to lose consciousness when you're fully concentrated on something. And then water sports was just advised to exercise with caution because of the increased risk of drowning. So it's always a good idea if someone with epilepsy is working out in like a swimming environment to have someone nearby that knows how to respond to water safety emergencies. So the benefits of exercise, people with epilepsy, there's been tons of research to show that exercising with epilepsy actually reduces the frequency of seizures. It's still being looked into, but also exercise has been shown to improve the effectiveness of their anti-epileptic drugs that they may be on and reduce the adverse effects. So some of these epileptic drugs do have negative impacts, and one is that they reduce bone density. So exercising improves bone growth, and that could lead to an overall decrease in the risk for osteoporosis. Depression and anxiety can be heightened in those with epilepsy. So exercising regularly can help manage symptoms by allowing them to cope with stress, sleep better, and better regulate their mood. And then those who actively exercise also experience the general health benefits, such as decreased risk for obesity, hypertension, diabetes, and other diseases. So there are many anti-epileptic drugs that people use, and it's kind of like not a one size fits all. Those who have certain types of seizures use other types, and typically the right anti-epileptic drug should reduce or eliminate seizures with minimal side effects. And sometimes it takes a couple tries to find one that works, or maybe even a mix of a couple. So I just picked 3 to talk about, and the first is valproic acid. It can also be described by its brand name Depakote and is usually used for tonic-clonic seizure treatment, but can be used for partial seizures as well. It works by increasing GABA concentrations to prevent the brain cells from functioning as quickly. Some common side effects, though, include tremors, bone loss, risk of liver failure, and easy bruising. And then carbamazepine's brand name is Tegretol, and it's used for partial seizures, generalized tonic-clonic, or a mix of both. It works by turning off the sodium channels in the brain to limit the speed of electrical activity that the brain's working during a seizure. But some side effects can be blurred vision, sleepiness, and unsteady walking. And then the last is phenytoin, and it can be used to treat tonic-clonic or complex partial seizures. It works similarly by blocking sodium channels to allow or to slow brain activity. And some side effects are decreased coordination, shaky hands, and poor concentration. And again, these are just some types of anti-epileptic drugs. There are many that can be used. All right, so for my case study, I chose a 50-year-old female client who had been dealing with epilepsy majority of her life. She was diagnosed at age 40 when she encountered 2 tonic-clonic seizures. After trying numerous anti-epileptic drugs, she found that Tegretol had the most success at reducing her seizure severity. She regularly takes 1,000 milligrams each day. She used to be very active in her 20s and early 30s, but ever since her diagnosis has become mostly sedentary and her BMI is creeping to become overweight. She wants to start exercising again to get back to living a healthier lifestyle. So the exercise test I chose for her would be to do a 6-minute walk test to calculate her VO2 max. And I chose this since she's at a higher risk of falling or injury due to tonic-clonic seizures. Just to be safe, instead of putting her on a treadmill, I chose the 6-minute walk test since it can be done on a flat outdoor surface. And then for her strength test, I decided to do a 6-rep max since she's not used to lifting weights and has been athletic in the past. I would still want to find weights, still want to find relative data to determine how much weight to use, but didn't want to max her out right away. And then for flexibility, I decided to measure using a goniometer to determine range of motion at her major joints. And with this data, we can compare her flexibility to other women her age and therefore determine a better flexibility program. All right, so for her exercise prescription, it's pretty similar to the average healthy adult, just backing off a little bit since she has been sedentary for the past couple of years. So for cardiovascular, I chose to exercise her 3 to 5 times a week, one or more days of vigorous 70 to 80% heart rate reserve, and 2 to 3 days of moderate 40 to 60%, 30 to 60 minutes. And this can be done in bouts in the beginning, like 10 minutes, 15 minutes, 20-minute bouts. And I chose walking, running, HIIT training, or cycling. I didn't want to include any swimming just because of the risk of seizures, but maybe as she progresses, we can add some in there. And then for muscular strength, I want to work her 2 to 3 times a week, working 50 to 60%, 1-rep max, all major muscle groups, 8 to 12 reps, 2 to 4 sets, between 30 and 45 minutes per session, a combination of free weights, machines, bodyweight exercises. Maybe start off with the bodyweight exercises and then progress to lifting heavier weights. And then for flexibility, I wanted to start her 2 to 3 times per week, stretching to slight tension, holding 15 to 30 seconds of each major muscle group, probably around 15 to 20 minutes, combination of yoga, Pilates, dynamic and static stretching. And with the yoga and Pilates, those are also great mindfulness activities that can help release any symptoms of depression or anxiety. So precautions and modifications, since she is taking Tegretol, which increases sleepiness, monitoring her tiredness before, during, and after exercise is going to be important. And if she comes in one day and is just way too tired and can't put like a finger to it, like it's not because of a lack of sleep, not because of something going on, then it might just be a day that we would take to rest instead, which was going to be okay, and that's going to be needing to be modified. Also making sure she's getting adequate hydration and taking breaks if necessary. having a proper warm up and cool down, especially making sure those muscles are nice and warmed up before we start, and getting that heart rate down, maybe even having a little bit of a longer cool down in order to decrease the risk of having a seizure in hours following exercise, avoiding any of those high risk activities mentioned, and setting up an environment to minimize injury, even though it is unlikely, having a seizure response plan just in case she does happen to have a seizure during exercise, making sure that she's working out in an environment that would cause the least amount of injury if she was to have a seizure. So to conclude, epilepsy is a very common disease, and it's actually very hard to find the right medications, but once you do, you're able to exercise just as much as the average American, and exercising is actually super beneficial in treating the symptoms. And then here are my references.